Hello everyone, welcome back to our channel CPC Adda. Today we are going to discuss about three different modifiers, modifier 62, 63 and 66. Now we'll start with modifier 62. Modifier 62 is two surgeons. When there is involvement of two different surgeons in single procedure, then we have to utilize modifier 62. Let's see in deep. Modifier 62 is used to indicate that two surgeons worked together as primary surgeons, each performing distinct part of single procedure. Okay, two surgeons have to involve in single procedure, then both surgeons have to do different parts of the procedure. So modifier 62 is appended to a surgical procedure code to signify that two surgeons, each with different specialties, operated together as primary surgeons on the same procedure. Each surgeon must perform a distinct part of the procedure and both are equally responsible for the surgery. So how to use modifier 62? So use modifier 62 when two surgeons with different specialties are necessary to perform distinct part of the complex procedure. Both surgeons act as primary surgeons and share responsibility for the entire surgery. So let's see the example for modifier 62. Example 1. During a complex cardiovascular surgery, a cardiac surgeon and a vascular surgeon work together. See here two different surgeons, cardiac surgeon and vascular surgeon working together. The cardiac surgeon handles the heart related aspects while the vascular surgeon manages the blood vessels. So here vascular surgeon and cardiac surgeon involved in cardiovascular surgery, and cardiac surgeon handles the heart related issues and vascular surgeon manages the blood vessels. So modifier 62 is appended to the procedure code to indicate the collaboration of two different surgeons in single procedure. Okay, so next example. In a complex spinal surgery, an orthopedic surgeon and a neurosurgeon perform the operation together. The orthopedic surgeon focuses on the structural aspects while the neurosurgeon addresses the neural elements. So modifier 62 is used to denote the co-surgery. Okay, so let's see the documentation requirements for modifier 62. So detailed operative reports from both surgeons clearly describing their distinct part of the procedure should mention. So the medical necessity for having two surgeons perform the single procedure also they should mention in the documentation. So next modifier 63. So modifier 63 is procedures performed on infants less than 4 kg body weight. So modifier 63 is used to indicate procedures performed on infants less than 4 kg, recognizing the increased complexity and risk associated with these cases. So modifier 63 is appended to a procedure code to indicate that the patient weighs less than 4 kilograms at the time of the procedure. This modifier reflects the increased technical complexity and risk involved in performing surgical procedures on very small infants. And usage criteria: the patient is an infant weighing less than 4 kg at the time of surgery, and the procedure involves significant additional complexity or risk due to the patient's low weight. So let's see the examples for modifier 63. Example 1. A neonate weighing 3.5 kg undergoes a hernia repair surgery. Due to the infant's low weight, the procedure involves additional complexity. So modifier 63 is appended to the procedure code to indicate these circumstances. Another example, a premature infant weighing 2.8 kg requires a cardiac procedure. The low weight of the patient necessitates special techniques and increased care. So modifier 63 is used to reflect the increased complexity. And see the documentation requirements. The patient's weight at the time of the procedure, details about the increased complexity or risk due to the low weight, specific challenges or modifications made to the procedure because of the patient's weight. These things should mention in the documentation. And next modifier, modifier 66, that is surgical team involvement in a procedure. So modifier 66 is used to indicate that a surgical procedure was performed by a surgical team, highlighting the complexity and collaborative effort required. So modifier 66 is appended to a procedure code to signify that the surgery was performed by a team of surgeons, each with distinct and essential roles working together to complete a complex procedure. Let's see the usage criteria. A procedure requires a surgical team due to its complexity, duration, or need for specialized skills from different surgeons. So each member of a surgical team contributes significantly to the procedure. Let's see the example for modifier 66. Example 1. A complex liver transplant surgery involves a transplant surgeon, a hepatobiliary surgeon, and an anesthesiologist working as a team. Here three different type of surgeons involving in a single procedure. Okay, so we have to utilize the modifier 66 to denote that there is a team effort. And another example, a patient undergoing a complex spine surgery might require an orthopedic surgeon, a neurosurgeon, and a vascular surgeon. So modifier 66 is used to denote the collaborative nature of the surgical team. And the documentation requirements for modifier 66 is a specific roles and contributions of each team member have to mention, the necessity for the team approach due to the complexity or requirements of the procedure, detailed operative reports from all surgeons involved in this particular procedure should mention in the documentation. So that's it for today's session. It is all about modifier 62, 63 and 66. And modifier 62 is two different surgeons involved in one particular procedure and they both performing two different aspects. Both are performing two different aspects in a single procedure. Then we have to use modifier 62. And modifier 63, procedures performing on infant whose body weight is less than 4 kg. So whenever performing procedures on less than 4 kg body weight patient, there is complexity of procedure. Complexity will increase in that particular procedure due to body weight, low body weight, and also specialized techniques also required to perform that particular procedure on very small infant. So to report that situation you have to utilize modifier 63. And next modifier 66, this is team effort, surgical team involving in a particular procedure. It means more than two surgeons involved in particular procedure. Also we can represent modifier 66 with the procedure code to denote there is a surgical team involved in this particular procedure. Okay, so that's it for today. Thanks for watching. You can reach me at given WhatsApp number. Please like, share and subscribe our channel for more support. Thank you.